My name is Zachary Spiro. I'm a student physical therapist here at the lab. I've been working with Gary Welch, the physical therapist, Joanne, the PTA, and Mary for the past few months. And today I'm going to give a little lecture about our balance system, how it works, and some ways that we could possibly improve it with some exercises. So to begin, I'm just going to start with a few statistics. Each year, 1 out of every 3 adults over the age of 65 experiences a fall. 20 to 30% of those who fall will be left with moderate to severe injuries. These falls are the leading cause of fatal and non-fatal injuries among older adults, and the direct medical cost was $30 billion in 2010. Falling is the leading cause of off-site related injury and the second leading cause of work-related injury. So this graph is from the Center of Disease Control, and it's an annualized rate of the incidence of falls. Here, you'll see that this is just an average of the total falls, not a total. And what I wanted to emphasize in this picture is that from the age of 45 to 75, we see a huge leap in the incidence of falls. And now I'm going to introduce that age. As we get older, that's an actual direct risk factor for falling. So it's really important that when we're in our 30s and our 40s, that we take the time to remain active and exercise and challenge our balance systems so we can maintain steadiness into our 60s and our 70s. So, through past balance screenings here at the lab, we have seen that 50% of people who come in who were screened are at risk for falls. That being said, 90% of these patients can reach excellent balance after training. So there is something we could do to treat balance and improve through exercises and training that we could do in physical therapy. So as I'd mentioned, statistics show that as we get older, there's age-related changes and there's complications in our body systems, and this is a direct link to falling. So there's 2 types of aging. There's primary aging, which is the gradual and inevitable process of deterioration of body systems throughout the lifespan. And there's really not much we can do about this. This is just a natural process. But the secondary aging is the aging process affected by disease, illness, bodily abuse, and most importantly, inactivity, because that's something that we can change, and that's something we could work on. So as depressing as it may seem, I'm going to go through all the changes we see as we age. In our musculoskeletal system, we see a decrease in muscle mass, decrease ease of tissue movement. I'll talk a little bit more about those changes, those chemical changes later in the PowerPoint, but for now, we also see restrictions in movement due to adhesions, and cartilage will dehydrate and convert to different types, and this increases stiffness. In our skeletal system, we often see osteoarthritis that leads to pain with movement, limits our range of motion, and we see postural changes in hunching over, and this could all impair our balance. I'm going to go more into this a little bit later. So, also our sensory systems decrease. Our sense of touch decreases. We have a decreased vibratory sense in our lower extremities, and this is all input we take from our environment that helps us maintain balance and know where our body is in space and where our orientation. So also our vision decreases as well. Our ocular pupil actually decreases in size. We have a decreased ability to adapt to changes in light and things in our environment, and we're not really able to see depth cues and contours as well as we have in the past. Our cognition is slow. We have a slower reaction time in the way that we adapt to certain things in our environment. Longer time to process information, so these challenges we see daily. And most importantly, as these systems degrade, we become more sedentary, we slow down. And this is the most important thing that we're going to have to concentrate on improving throughout the years. So a little bit on the effects of inactivity and balance. As I had mentioned, we see a decrease in the viscosity of our tissues. The hyaline cartilage, which is surrounding our joints, is the healthy cartilage that we have at a young age, but as we get older and through inactivity as well, this smooth, shiny hyaline cartilage that surrounds our joints and allows for easy movement converts to fibrocartilage, which is a tough, dense material and increases stiffness, and you can't move as well. With this stiffness, we lose proprioception in our joints. Now, proprioception is the ability to know where your body is in space, know your orientation relative to your other bodily segments. So we also have a decrease in cerebral perfusion. We have decreased blood flow to the brain. This affects cognition. We can't tackle those obstacles as quickly as we could when we're active and when we have that blood flow to the brain. So as we age and with inactivity, there's an increase in fibrinogen in our surrounding tissues. Fibrinogen is a plasma protein, and fibrinogen eventually converts to fibrin. And fibrin is the substance in our bodies that leads to those adhesions and leads to those restrictions and the tightness, and it makes it difficult for us to move. Luckily, exercise is one thing that enhances the removal of fibrinogen, and secondarily, those adhesions and that restriction. So other than age, there are other things that can cause balance issues. We see that we've heard of vestibular diagnosis such as Meniere's disease and vertigo and acoustic neuromas, and these all play a part in balance deficiencies as well. Drop in blood pressure could cause dizziness and unsteadiness in our lives. Musculoskeletal impairment, if you have a fracture, any joint replacements, knee replacements, anything like that could cause the balance issues. Soft tissue injuries, lower extremity sprains, strains, and overall just loss of flexibility and strength. Other diagnoses associated are the traumatic brain injury, Parkinson's disease, stroke, multiple sclerosis, Huntington's disease, cerebral palsy, and lesions to the cerebellum, which is the portion of your brain that really is responsible for balance. So I've been saying balance a lot, and before I continue, I want to just define what the word balance is, and I'll show you up here. So balance is the ability to control your center of gravity within your base of support. And your center of gravity is the midpoint of all the body segments, the midpoint of the body weight. So for most people, it's right below the navel. And the base of support is the area beneath my feet and between my feet. And there's a line of gravity that travels from my center of gravity down to the floor. Now when I shift, this line moves, and as this line verges the end of my base of support, that's when I start to become unstable. So to remain balanced, you must maintain the center of gravity within the base of support. And then when the center of gravity is closer to the floor, closer to the base of support, will increase our stability. So when you bend your knees and you widen your stance, these are just some little methods that help bring your center of gravity closer to the support surface. And you can see here that this individual center of gravity is right there. This is the base of support, and as you bring it closer to the ground, you increase the stability. All right, a little more about the body systems. This is still just an overview because there's so many different systems in our body that can affect balance. As I said, joint range of motion, flexibility, strength, muscular balance, and body alignment. These are all things that affect our balance, and you can, as I've noted, when these things are compromised, we become deficient. Also, we have a nervous system. There's many recruitment patterns that the body undergoes during balance mechanisms. There's sensory processes that I'll talk a little more about, and there's a higher level processes such as anticipatory control, what we do before there's a disturbance, before there's a force, and the things that we do after, which are the compensatory control. I'm going to talk a little bit more about anticipatory control and compensatory control right now. So our anticipatory mechanism, these are pre-programmed responses that help us maintain stability. And these could be modified by experience. These are something that we could train and enhance. So this establishes postural adjustments before voluntary movement occurs. It allows for prediction of disturbances, and this mechanism is influenced by prior experience and improves with practice. So this involves constant monitoring from all systems at all time. And you'll see that An example of this would be if you're contracting your muscle in a certain way, or you're shifting your weight before a disturbance to ready yourself for the issue with balance or the outside force. So our compensatory mechanism, our feedback mechanism, is stimulated following the loss of balance or the unexpected force. It's automatic, it's a rapid response, and it's refined by practice and learning. And this is something that we could also work on. This is something we could also practice within the clinic, and you could practice this at home. A little more on those compensatory mechanisms. We see that we have something called an ankle strategy. So this is when a small and slow force is given. Here, that center of gravity I was talking about, right below our navel, that midpoint weight, remains within the limits of your stability, the limits of your base of support. So usually this will occur when an individual is standing on a firm support surface, and the surface that you're standing on is longer than the person's foot. An example would be a floor, things that we walk on every day. The ankle provides a great source of sensory input, and it tells us about our degree of sway and our position in space. And here, so if you're given that slow and small force, you're pivoting at your ankles, and that's maintaining the center of gravity. As you can see, if there's any issue with strength, any issue with balance, any issue with range of motion, the ankle strategy could be compromised, and then we'll have to use the next strategy we have, which is the hip strategy. This is when a bigger force is given, a larger force than that slow and small force you would see with the ankle strategy. Here, the center of gravity is closer to that limit. The surface the person is standing on is unstable or shorter than the person's foot. Could also be used when the support surface is soft. If you're standing on a mat or something like that, foam, grass. And another example of a surface that would use this strategy would be a balance beam or a step or something like that. Lastly, we have the stepping strategy. This is when the force given is so large that the ankle strategy and the hip strategy aren't enough to maintain balance. So you have to step forward, and in that you're actually creating a new base of support for your center of gravity to lie within. So here, a step will increase the base of support, and this occurs when all other strategies fail for whatever reason, whether it be the surface, whether it be the strength deficiency, or the flexibility. All right, so I had mentioned previously the sensory systems that are involved with balance. So our body, afferents, which are nerves that send information toward the brain that we get from many different systems, get information from the body from three different systems. We have the somatosensory system, the visual system, and the vestibular. So each provide the central nervous system with input that helps us maintain balance and postural control. So the first system is the vestibular input that I was talking about. So this offers a reference for vertical orientation and reports head motion relative to what is seen in the surrounding environment. Now, this is the most dominant system that we'll use, but it's also the most deceiving because as our vision decreases with age and we rely on this, this is when disturbances and issues with balance occur. So when you close your eyes, then now you're reliant on those other two systems, and that's what I'm going to go into now. So the somatosensory system. So this gives the central nervous system information about position and motion of the body with reference to the support surface where you're standing on. So this position of motion and where your body is in space, we're getting the information from receptors, whether it be in your joint, your muscle, on your skin, and also pressure receptors within your body. And these receptors are located deep in your tissues, and they go back to that concept I was talking about before of proprioception, knowing where your body is oriented in space at all times. So now I'm going to talk a little bit about the vestibular system. I don't know what this is. So the vestibular system provides the central nervous system, your brain and your spinal cord, information about your static head position when my head's not moving, and about changes in my head position when I'm moving, whether it's rotation or acceleration. These structures are are categorized as being a part of the inner ear, and they are comprised of semicircular canals and otoliths, which are made up of subcategories utricle and saccule. So semicircular canals, these are the canals right here. That you can see that are oriented in the 90-degree fashion. Within these canals, there's a fluid called endolymph. And the semicircular canals are most responsible for head rotation. So when I'm rotating my head like this, the fluid within my inner ear, within the semicircular canals called the endolymph, moves as well. With this movement, you're stimulating these tiny hair-like receptors, and these hair receptors, or these hair cells, send information to your brain from a nerve that connects your inner ear to your brain. So this is most responsible for detecting changes in rotation and velocity. Similarly to the hair cells I just mentioned, there's also located in the otoliths, in the utricle and the saccule, but instead of being in that fluid, the endolymph, it projects into a gelatinous-like substance, and on top of the gel are these tiny calcium crystals called otoconia. And as you move, instead of the fluid moving as it did in the semicircular canals, the weight from the crystals shift and then stimulate those tiny hair receptors, and that's how you detect linear acceleration, which is what the otoliths are most responsible for, whether it's me moving forward, backwards, side to side, up and down. The semicircular canals are responsible for rotation. The otoliths are responsible for linear acceleration. And any kind of deficiencies that you'll see, some of those vestibular diagnoses I was talking about, is sometimes you'll hear people say, oh, I have positional vertigo. And what happens is one of those tiny crystals I was talking about becomes dislodged from that gel and could go to an area of the inner ear it's not supposed to be in. And that could cause those symptoms of dizziness and loss of balance. And it's pretty cool that there's something you could do in physical therapy, a maneuver that you could do that could try to relocate that otoconia, that crystal, and correct those symptoms. So as you can see, there's not just one system that affects balance. It's comprised of so many different things going on that the body has to take in and really adjust for. So because there's not one system, there's not just one test. And a physical therapist could examine and test all these different aspects of balance, whether it be steady-state postural control in our seats while we're standing, or is it the anticipatory mechanism I was talking about before? We could test that. And compensatory control through those other strategies. So it's really important that we identify the impairment and know which systems we are targeting during treatment. So here at the lab, we really take safety very seriously, and it's our utmost concern that during these tests that we maintain safety, and we're trained in certain guarding techniques, and we know the level of assistance each patient requires. So here at the lab, we have piece of equipment made by Biodex. It's called the Balance SD system. It's right over here to my left. And this is what we often use to do some of the balance testing. So this piece of machine allows testing and training in static with the platform not moving, and dynamic settings where the platform is given some degrees of freedom and you kind of have to try to maintain that angle. So this offers a fall risk assessment. Some of you are familiar with that. I was talking before that you've actually taken this test. It also offers weight-bearing assessment and conditioning for patients who are seeking therapy for lower extremity issues, sprains, fractures, replacements. And each training session is documented so we can kind of see our progress, see if we're making any difference with our therapy. So the static testing, we measure the excursion of the patient's center of gravity, that midpoint, through weight shifting. And good scores can lead to dynamic testing, where, as I said, we have offered more degrees of freedom on that platform, and you have to maintain the stability. So the test formats are postural stability, limits of stability, athletics single leg, and what we use the most is the fall risk assessment, and that identifies potential candidates for falls. So during this test, there's 3 trials, it's 20 seconds apiece, and there's a 10-second break in between. What it does is you have to stand on the platform, and it measures your center of gravity to a reference point within the piece of equipment. When the trial begins, you have to try to maintain the angle of the platform, and it measures the excursion you'll take during that. As soon as you touch the handrails, the test becomes invalid, and we'd have to do it again. But it's very safe, and it's a great way to track your progress. Now, would anybody like to come down? We have the machine here. I won't tell anybody your scores, but we could try out the balance system, and I could kind of show everybody how it works. Do we, anybody interested? Okay, you can come down. Thank you for volunteering. All right, so what you're going to do is you can step right up on this platform.
This way?
Yep, you're going to be looking straight at the screen. So what I'm going to do is in the testing format, I'm going to go to the fall risk assessment, and here you can put in your name.
And?
It doesn't really matter for now, but then you can put in your age. We won't look. You can
My
put
age?
your age.
Nobody look, right?
Nobody's looking.
Okay. How do I do now?
All right. So from here, this is your height. We'll put your height in. We go to next. So this is the portion where we try to get your center of gravity to this reference point. So what I want you to do is, you see the 25 degrees there? Step up a little bit, and on the other foot as well. Yeah. And then we'll confirm. So we want this dot to be in line with that one. So move forward a little bit, just so that dot lies within the other one. And actually back a little more. A little further. We want that dot to be right in the middle. A little further back.
Further?
Yep, further back.
Okay.
Yeah.
All right.
And good. And get that dot to be right on line. In line, a little closer. Lean back. Good. So when I press start, it's going to release the platform. And I'm going to be behind you in case you need. And as soon as you touch the handrails, the test becomes invalid. But if you need to, that's definitely acceptable. So when I press start, you're going to try to keep that dot right in the middle.
Do I have to look at it?
You can look at it it's good to look at it because you're going to see it sway back and forth. But what the aim is to keep the dot right in the middle.
Okay.
So when I press start, and now we're going to collect the data. The trial begins in 1 second. So now the test is started. And slowly it starts at level 6, which is 12 is the most stable, and it goes down to level 2, which is the least stable. So it starts at 6 and progressively goes down to 2. Now it's good that you could catch yourself if you have to. Good. And then we have a rest for 10 seconds.
That's not easy.
It's not easy. But you could bend your knees and shift your weight to maintain. So we're going to have another 3 trials we go through. Now we're going to collect the data. And we started. Good. And that noise, you hear the platform offering more degrees of freedom as it goes from level 6 to level 2.
That I don't like it.
You don't like that last part?
Yes.
All right.
Too much.
Good. Now you get a little rest, and we have one more time, and then we'll look at the results.
I feel really bad. So you have to move yourself so you can keep it.
Yes.
Okay. I have to know how to dance ballet dancer while we do that.
Good. So the test is done. Now we can look at the results.
Well, right?
So your score is not because it's compared to the age range norms. So from there, this looks like we could do some work. We could do some things in therapy. So that's just, thank you for coming down. That was just a visual of how the test actually goes, and we could see that there's age ranges here. And if your score doesn't lie within it, then there's things we can work on.
What should be the score?
8.6 for you should be
what?
2 point, anywhere between 2 to 3.5.
Oh dear.
Thank you very much. Okay. So this slide is just to emphasize that through training and through practice, we can make lasting changes in our balance. We could actually change the circuitry in our brain. And neuroplasticity is the way in which the brain encodes experience and new behavior. And this is by doing specific training to the balance and challenging your balance. All right, so throughout the day, what I want all of you to do is just kind of take notice of the way you move in your transitions. And just ask yourself a few questions. Are you relying more on handrails when going up and down stairs? How quickly and comfortably can you rise from a chair? Are you leaning on armrests when getting out of a chair? Do you feel unsteady when feet are close together? How fast do you begin to fall after you're being nudged? And are you reaching for stationary objects or the wall to keep you steady throughout the day? And if any of this is yes, if you think any of this is true for you, here are just a few exercises you could do at home or with a friend for safety measures that could help improve your balance. All right, so I'll actually show you these. So the first one, if you don't have an exercise ball, you could use a couch or a cushion or something like that. And first we'll start off just by shifting our weight. So we shift our weight side to side. And as you get better, you could continue to move that center of gravity outside of your base of support. And that, as simple as it seems, could be difficult for a lot of people. And that's challenging your balance system. And that's improving those mechanisms. That's actually specifically improving that anticipatory mechanism we were talking about. Oh. So from here, you could progress by lifting 1 foot at a time and then holding it 5 seconds. And this could be done on a couch cushion or anything soft that's similar. And then you hold, and then you could alternate with arm movements as well. Lift and lift. And this is all challenging your balance. So the next thing we could do is stand on a few thick pillows stacked on top of each other. What I have here is something we have within the clinic at the lab. It's called a Bosu ball. So what you would do here is you would stand on here and try to shift your weight just like before. We have people in therapy do this all the time. As you get better at this, you could progress to standing on one leg, and that's not easy. And then you could progress to standing on one leg while swinging your hip. If you don't have a Bosu ball, you could do this on a stack of pillows because that creates that unstable environment. Strengthen the hips. This is another exercise that we give in therapy all the time. You could have a support surface just like a countertop or a table, and we'll do to strengthen our hip, which helps play a part in balance. We could just do single straight leg raises just like this, out 10 times. And you go out to the side 10 times, if this wasn't here, 10 times. And then back, and you could also come out and come in. While you're here, you could also do high marches, and this will strengthen the hips as well. Also, with the support surface, we could stand on one leg and count. And there's age-related norms that you could compare this to see how you're progressing, and try to slowly wean off the support surface. And lastly, you could do sitting, just even the exercise of sitting in a chair to standing. That helps strengthen your legs and will improve your balance. So first, you could start sitting just like this, your feet wide apart. Do this 10 times. Sit to stand 10 times. As you're getting better at this, you could bring your feet closer together. Sit to stand 10 times. And then to the point where you can put your feet right next to each other, and this is challenging your balance system even more. And sit to stand like that. So those are just a few. And I have the handout I'd given you kind of explains those exercises and give you pictures so you can remember. It actually offers a few more. All right. So on top of all these exercises and on top of improving balance, It's also important that we make our environment safe. And I know you've all heard this before, but I just want to reiterate that we should make sure our pathways are clear. We remove throw rugs from the floor, apply non-slip backing and double-sided tape. You could coil or tape wires next to the wall. Report loose or uneven stairs. There should be light switches at the bottom and top of all stairs. Make sure the handrails aren't loose and are on both sides of the stairs. And keep things that are often used on lower shelves. And I know these things seem obvious, but all the things in our environment that go overlooked are often hazardous. And it's just the simple little things that we could do to improve our balance and kind of make our environment safer. So a few more tips. Exercise regularly. That could be the most important thing. Just moving and challenging that system. You'll be surprised at how much you improve your balance just through exercise. Have your healthcare professional check the medicines you've been taking. Some of them could cause dizziness and drowsiness. And these include antibiotics, blood pressure medications, depression and anxiety medicine, pain medicines, and chemotherapy medications. Also have your vision checked annually. If you have low blood pressure, get up very slow when transitioning, when moving from sit to stand or from lying down, because often your blood pressure will drop and you'll get dizzy. So if you have low blood pressure, just make sure to take that precaution. Have uniform lighting in a room, and have a contrast color on the top of each step. So I know last year there was a safety day here at the lab. I think it was June 19th last year. I don't know the date that it is this year, but I'm sure that they're going to have it, and this balance system will be there. There's a fall protection demonstration and demonstration on walking surfaces, shoes, and the slip meter. So you guys could all come to that for further demonstrations and ways to improve balance. And Mary has a sign-up sheet. If any of you want to come down to the clinic here at the lab, you could sign up for a time. It will take 15 minutes, and we could do a fall risk assessment. If you feel balance is an issue, you could come down, we could test you, we could see where we are, and then if balance is an issue, we could set up appointments, and we could start doing exercises and using that piece of equipment to improve. So come on down if you'd like, sign up for a 15-minute session, and we'll try to figure something out. Thank you guys all for coming. I hope this was helpful. And the sign-up will be here. Please help yourself to some cake and handouts. And thank you all again.